Hi, my name is Tamara Rodriguez and I'm going to talk about hydrocortisone plus fludrocortisone for adults with septic shock. About the definition, septic shock is characterized by a dysregulated host response to infection, resulting in life-threatening circulatory, cellular, and metabolic abnormalities. The short-term mortality is approximately 45 to 50% and 50% of survivors of sepsis may have subsequent long-term cognitive decline. Experimental and clinical evidence suggests that sepsis is associated with a dysregulated response of the hypothalamic pituitary adrenal axis that may involve any of the steps from cortisol production to cortisol use by cells. Corticosteroids have been used in the treatment of patients with severe infections since the mid-20th century. Now a video.
Doctor, the patient came in this morning with an altered level of consciousness, fever, and uncontrolled bowel movements. He does not speak English and his caretaker is in the waiting room.
Well, get the caretaker in here. Can we get a line established and hang a liter of fluid wide open?
The paramedic intern started at 18 gauge in the left forearm. The patient's vital signs are blood pressure 88/60, pulse 130, respirations 20, and a temperature of 104.5 degrees.
Go ahead and administer Tylenol or Puerto Rico and get a full set of cultures. Once the first liter of fluid is in, go ahead and hang another 1000 cc's. I am going to place a central line in his left external jugular. Also, while we wait for the blood test to come back, we can start him on a broad-spectrum antibiotic. He appears to be septic.
Doctor, we are now a few hours into treatment and have administered 4 liters of normal saline. The blood pressure will not stay above 90 systolic. The patient's temperature has come down to 101.5 degrees and his pulse is now at 110. The ICU now has a bed open.
Okay, let's get him up to the ICU. Good job, team.
About application in medicine. A multi-center, double-blind, randomized trial with a 2x2 factorial design was evaluated that the effect of hydrocortisone plus fludrocortisone therapy, the trocoin alpha activated, the combination of the 3 drugs or their respective placebos. After trocoin alpha activated was withdrawn from the market, the trial continued with a 2-group parallel design. The analysis compared patients who received hydrocortisone plus fludrocortisone with those who did not, placebo group. Among the 1241 patients included in the trial, the 90-day mortality was 43%. In the hydrocortisone plus fludrocortisone group, had 49.1%. In the placebo group, the relative risk of the death in the hydrocortisone plus fludrocortisone group was 0.88, with a 95% of confidence interval. Mortality was significantly lower in the hydrocortisone plus fludrocortisone group than in the placebo group. The rate of serious adverse events did not differ significantly between the 2 groups, but hyperglycemia was more common in the hydrocortisone plus fludrocortisone group. Another video.
Hello YouTube, Dr. Carlo Ogier here, board certified emergency physician with ED Exit Video Pro. If you give me 5 minutes, you will learn something new with every video, so make sure you subscribe. In this video, we're going to discuss an article from the JAMA, Journal of the American Medical Association, published in 2016, having to deal with hydrocortisone and septic shock. Does hydrocortisone given in the IV form help prevent progression to septic shock? Well, the current guidelines are if that a patient is in septic shock and using vasopressors, hydrocortisone given in the IV form is beneficial to patients. So, to answer the questions, can hydrocortisone prevent the progression to septic shock? A randomized, double-blind control study was done in Germany with almost 400 patients, given hydrocortisone IV for 5 days and a tapering dose over the next 11 days. This was called the HYPRESS study. High for hydrocortisone prevention, PRE, of septic shock. And the bottom line, the answer is it did not show any benefit. It did not show any difference in the prevention to the development of septic shock. However, most critics of this research article say that the power of the study was too low. That means if they were to do a study in 4,000 patients instead of 400, there might be a difference. But the bottom line, the conclusion of the study is this. We already know that in septic shock, patients already on vasopressors for the treatment of septic shock, hydrocortisone IV is a current guideline of treatment. The question is whether or not there's a benefit into the prevention of development of the septic shock. Well, they failed to show any benefit. However, they failed to show any disbenefit or any complications from it. So what they suggest is if the patient is in sepsis and you're already starting to think about starting vasopressor, that means in the early development of septic shock, you might as well start the hydrocortisone because there is no evidence against it, although the evidence for it is not that good anyway. So that's it. Conclusion, there is no data showing benefit, but it doesn't hurt. If you're thinking about vasopressors or if you're already on septic shock, go ahead and give that IV hydrocortisone to those patients. I hope you learned in this video. Subscribe.
About issue applied in Ecuador, the use of this combination of drugs in Ecuador has not been proven, and there are no studies that demonstrate its efficacy in the country. Now, we are going to present a new video.
The sepsis is a particular disease of infection, and it is normally infected by a bacterial infection in the blood. Sepsis is also called septicemia. Anybody can be infected by this problem, but it is most regular and most risky in older adults or who have weakened immune systems. Sepsis happens when the chemical discharged into our bloodstream to fight the inflammatory reactions. This inflammation may produce a flow of changes, and it can damage multiple organ systems of the human body. Sepsis is a life-threatening disease, and it can lead to organ failure, tissue damage, and finally death. Sepsis also can develop when our body keeps overactive and toxic response to an infection. If your blood pressure drops, it can be another source of this problem. Viral, bacterial, or fungal reactions commonly may lead to the infection. There are some causes and risk factors to infect this problem, such as if anybody has pneumonia disease, they have a great chance to get this infection. Abdominal infection and kidney infection lead to developing this sepsis problem. If anyone has a bloodstream infection, he can be infected with the sepsis disease. Any people can be infected by this problem, but very old or very young people are the most sufferer of this disease. If you have a weak immune system, you have a greater chance to develop this problem. People who are already very sick in a hospital's intensive care unit, they can be infected by this infection. If people have past or present injuries or wound history, they can get this problem. If people use an invasive device, such as breathing tubes or intravenous catheters, they can be infected with this infectious disease. Sepsis ranges from less to more severe. It can weaken your blood flow to essential organs, such as your heart, brain, and kidneys. Sepsis may also cause blood clots to form in your arms, your organs, legs, toes, and fingers. If you have any...
Now, about pros and cons, we have 2 pros and 3 cons. About the pros, mortality was significantly lower in the hydrocortisone plus fludrocortisone group than in the placebo group at ICU discharge. About the another pro, patients in the hydrocortisone plus fludrocortisone group had significantly more vasopressor-free days to day 28 than those in the placebo group. About the cons, hyperglycemia was more common in hydrocortisone plus fludrocortisone group. They had at least one serious adverse event by day, and also the gastrointestinal bleedings. In conclusion, in the trial involving patients with septic shock, 90-day all-cause mortality was lower among those who received hydrocortisone plus fludrocortisone than among those who received placebo. This is why it can be concluded that these corticosteroid drugs such as hydrocortisone plus fludrocortisone have a beneficial effect in treating septic shock. The last video.
The medical team in this intensive care unit at Mayo Clinic is on high alert 24/7, watching for signs of sepsis.
Sepsis is a potentially life-threatening complication related to an infection.
Dr. Kenan Ramar says every year close to 750,000 people in the U.S. develop a septic reaction. It happens when an infection prompts the immune system to kick into overdrive, causing problems such as kidney failure, liver failure, severe drops in blood pressure, and even death.
It becomes very important that this is recognized early.
That's because the death rate can be very high, up to 75% for people who develop sepsis at home and up to 25% for those who get it in the hospital.
It's almost similar to treating a heart attack or a stroke, where you have a very short window
That window is 6 hours. Dr. Ramar's team uses what are called sepsis sniffers, technology that monitors things like fever, heart rate, and blood pressure, and alerts the medical team when a patient's in danger.
Okay, I think let's go ahead and activate the sepsis response team.
We have a patient in room number 20. We want to activate the SRT.
If blood tests confirm that's true, the septic response team launches into action.
It's a big multidisciplinary approach to do this. And so all members of the ICU team are actively involved to get this aggressive resuscitation going and to get all things done within that 6-hour window period. Let's get the central line ready.
We did give a dose down in the ED, so continue with that.
We follow what we call as the surviving sepsis resuscitation guidelines.
Methods of best practice developed by the Society of Critical Care Medicine to ensure the best possible treatment for patients.
If the necessary things are done, then the mortality drops down dramatically.
Sniffing out sepsis and saving lives. For Mayo Clinic News Network, I'm Vivian Williams.
Thank you for your attention.